Good evening, ladies and gentlemen, and thank you for joining us for this COVID-19 update brought to you by the Ministry of Health, Wellness and New Health Investment, Dominica. We recognize the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Director of the Primary Healthcare Services, Dr. Gilida Nesty-Tonge, our National Epidemiologist, Dr. Shalauddin Ahmed. Also with us this evening, Senior Environmental Health Officer, Calma Louis, and Acting Deputy Chief of Police, Davidson Valerie. Of course, we'll begin this evening by bringing you an update on Dominica's statistics presented by Dr. Ahmed.
Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre. Permanent Secretary in the Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke. Dr. Gilida Nesty-Tonge, Director of Primary Healthcare Services. Ms. Calma Louis, Senior Environmental Health Officer. And Acting Deputy Chief of Police, Davidson Valerie. And our very own Ms. Sheena Harry, Communication Officer, and media and listeners. Good evening to all. As of today, our active COVID cases are 17. A total of 55 cases has successfully recovered, and there are no deaths to date. Over the past week, we have had 4 new confirmed cases of COVID-19. 2 of these 4 cases linked to a cluster originating from the All Saints University. The 3rd case was identified following a rapid test performed at the Douglas Charles Airport during entry. The 4th case is a foreign national identified via pre-travel screening. The investigation is ongoing and information will be shared with public as it becomes available. These 4 cases are between the ages of 23 to 38 years old, 2 males and 2 females. They are asymptomatic now, but 2 of them exhibited mild flu-like symptoms, mainly low-grade fever and runny nose, about a week prior to their diagnosis. Contact tracing is ongoing. So far, 72 contacts have been tested and all are negative. Further to our contact tracing, we have initiated mass screening at the All Saints University, where the recent cluster cases was identified. The preliminary reports that I have, it indicates that a total of 142 rapid antibody tests are completed today. Of these, 4 of them were IgM positive, and they were swabbed today for confirmatory testing. A summary update will be shared with you all at our later date. Now, I would like to briefly remind everyone on the features which make COVID-19 different or similar to flu virus. Clinical presentation. It is hard to distinguish COVID from flu based on signs and symptoms, especially at the beginning of the symptoms. Both may progress into severe condition and requiring hospitalization. Without a definitive laboratory diagnosis, it is not possible to differentiate one from the other. But COVID cases may present with loss of smell and taste, which is typical to COVID-19 only. In terms of incubation period, which is the period between exposure and onset of illness, a COVID-19 case may take between 2 to 14 days, whereas flu case takes between 1 to 4 days. Hence, the flu has a short incubation period. In terms of duration of infectiousness, COVID-19 cases may be infectious about 2 days before experiencing signs or symptoms and could remain contagious for at least 10 days after signs or symptoms first appear. On the other hand, flu cases are contagious for about 1 day before they show symptoms and may remain contagious up to 7 days. In terms of transmission, both COVID-19 and flu can spread from person to person, especially between people who are in close contact with one another. Both are spread mainly by droplets made when people with illness cough, sneeze, or talk. Contaminated surfaces and objects would be the other source of transmission. But the difference is COVID-19 is considered a super spreading disease. It has a mean reproduction rate of 5.7, whereas reproduction rate for flu is about 1.5. This means a person with COVID-19 can transmit it to about 6 people on average and 2 persons with the flu on average. Lastly, let me take this opportunity to once again emphasize the importance of wearing a face mask while in public space, frequent hand washing or the use of alcohol-based hand sanitizer, maintaining a 6-foot physical distance from others, and those who are experiencing flu-like illness, stay away from public gatherings and stay home. With this, I thank you and have a good evening.
Thank you so much, Dr. Shalauddin Ahmed, the national epidemiologist. Also with us this evening, we have the Director of Primary Healthcare Services, Dr. Gilida Nesty-Tonge, and of course, Dr. Nesty-Tonge and her team are responsible for what we now know as contact tracing, and she will be presenting this evening as well.
Minister of Health, Wellness and New Health Investments, Dr. the Honorable Irvin McIntyre. PS of Health, Wellness and New Health Investments, Mrs. Leticia Lestrade-Wyke. National Epidemiologist Acting, Dr. Shalauddin Ahmed. Senior Environmental Health Officer, Ms. Calma Louis. Acting Deputy Chief of Police, Mr. Davidson Valerie. And Sheena Harry, our Communications Officer. Good evening. The concept of contact tracing and quarantine continues to be difficult to understand for many. First of all, there are 2 types of contacts, high-risk and low-risk contacts. A high-risk contact or a primary contact is considered a close contact. A low-risk or casual contact are your secondary contacts or your tertiary contacts. A high risk or a primary contact is anyone who has been within 6 feet of an infected person or someone who has the COVID-19 virus for at least 15 minutes. Other high-risk contacts include household contacts, individuals with greater than 15 minutes face-to-face exposure, healthcare workers exposed to a positive case without the appropriate use of a personal protective equipment or PPE, passengers on an aircraft within 2 seats in any direction, individuals sharing a close space with a COVID-19 case for greater than 2 hours, but not within 2 meters of one another, and any individual who comes into direct contact with body fluids and lab specimens of a diseased case. A casual contact is a low-risk contact and includes healthcare workers who have taken appropriate PPE precautions, individuals sharing a close space for less than 2 hours, but not within 2 feet of one another, and passengers on an aircraft beyond 2 feet in any direction. Once a positive COVID-19 individual is identified, he or she is asked to generate a list of individuals who fit the criteria of a primary contact. Ladies and gentlemen, that positive case could be anyone. It is for this reason the Ministry of Health, under the government of Dominica, continues to stress the importance of wearing your mask, washing of your hands, and maintaining a safe social distance. Adequate coverage of the nose and mouth is critical, as the nose and mouth are two ports of entry for the COVID-19 virus. Following these measures reduces your chance of being diagnosed with COVID-19. It reduces your chance of having to be picked up by the COVID ambulance, which a number of persons detest due to the attached stigma. It also reduces your chance of being placed in isolation at the COVID isolation unit in Portsmouth for about 3 weeks, which then becomes a necessary inconvenience. Important to note is that primary contacts are asked to remain in quarantine for a period of 14 days from the last time they were in contact with the infected case. Quarantine entails the strict restriction of movement or the separation from the rest of the population of healthy persons who may have been exposed to the virus. This has the objective which allows you to monitor for signs and symptoms, ensuring early detection of a potential case. You are also expected to be placed in quarantine when coming from high-risk countries, example Guadeloupe or Martinique. In this case, the quarantine period is at least 5 days at a government-certified quarantine facility. On day 5, a PCR nasopharyngeal swab is done. Results can take up to 48 hours. You are expected to remain in quarantine until your results are given to you and until you are cleared by a medical professional. Quarantine is different from isolation, which is the separation of sick or infected persons from others to prevent the spread of the virus. In primary health care, once a positive COVID-19 case is identified, the contact tracing team is immediately activated. All members are notified of the new case. Members are assembled to devise a strategy and plan for obtaining all pertinent details of the case. Sometimes this involves actively conducting interviews on the streets, at bars, and within specific communities, especially when the case is not forthcoming in terms of who their contacts are. This limits the efficiency of contact tracing and places each and every one of us at risk. The positive case, often referred to as the index case, is safely questioned during an interview while adhering to all the recommended health protective guidelines. If the individual is a returnee to the island via whatever means, the interview will include details of every stop and every person encountered on his or her return. Further information such as names and nicknames of contacts are gathered, addresses, telephone numbers, other locating information, as well as date of first and last exposure is also vital. Again, every individual the diseased case has been in close contact with, as defined above, is considered a primary contact. The contact tracing team works tirelessly, the goal being to identify all potential contacts and to secure the health and well-being of our people. After identification, primary contacts are asked and advised by the contact tracing team to home quarantine for 14 days. This means, as a primary contact, you stay home. You do not leave your house. If the primary contact does not live alone or lives in an extended family home situation, that primary contact is asked to isolate themselves in a room within the home until quarantine is complete. Individuals are also asked to monitor themselves for signs and symptoms of COVID-19, such as fever, cough, weakness, and shortness of breath. During the course of self-quarantining, the primary contact undergoes a PCR swab 5 days from the date of last contact with the index case. If signs and symptoms of COVID-19 are suspected during the quarantine period, the contact will also be tested for COVID-19. For safe testing to occur and to prevent breach of quarantine, a mobile team is dispatched or deployed to the address of the primary contact. After a successful 14-day period of self-quarantine, meaning no signs and symptoms of COVID-19 and a negative PCR, the individual is then cleared by a medical practitioner. A medical certificate indicating quarantine period is also handed to the contact. If a primary contact yields a positive PCR result, then the contact tracing cycle is repeated for all contacts of that newly diagnosed case. Thank you very much.
And thank you so much to Dr. Gilida Nesty-Tonge, the Director of Primary Healthcare Services. The next presenter is Senior Environmental Health Officer Calma Louis. And of course, the Environmental Health Department, for those of you who have come into Dominica, would have recognized them at our borders. And they're also responsible for compliance in our business places as well. Calma Louis, our next presenter this evening.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irving McIntyre, Permanent Secretary of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White, National Epidemiologist, Dr. Shalauddin Ahmed, Director, Primary Health Care Services, Dr. Gilida Nesty, Acting Deputy Chief of Police, Davidson Valerie, Communication Officer for the Ministry of Health, Wellness and New Health Investment, Ms. Sheena Harry, the general public, good evening. The ongoing COVID-19 pandemic has changed the way we socialize, the way we work, and overall, the way of living. The Ministry of Health has developed protocols to protect and safeguard the health and safety of the general public. The Environmental Health Department continues to do routine visits and work together with other departments in ensuring these protocols are adhered to. To date, protocols have been established for facilities such as schools to include daycare, primary schools, secondary and tertiary institutions, churches, restaurants, bars, gyms, and spas, hair and barber shops. These protocols include wearing of masks, social distancing, hand hygiene, and respiratory etiquette. Finding upon visits have revealed that many of these facilities have implemented their own measures to protect the health and safety of their employees and their customers. They have established measures to include hand sanitizing upon entrance, wearing of masks, and a few have also implemented temperature screening. These measures are all established in the interest of protecting health. However, the general public must not forget that there is an integrated approach to safeguarding against COVID-19 and be mindful to practice physical distancing at all times, especially when in public places. This continues to be a major challenge as persons seem to let down their guards and think that it is okay to wear a mask but not to social distance, especially in bars, restaurants, and churches. Management must also ensure that for hand sanitizing, the concentration of alcohol is 70% and should not be diluted with water or any other product. And I say so because a lot of times we go into different establishments and we get different and types of hand sanitizer. So please follow the instructions, 70% and no dilution. This reduces the risk. This reduces the effect of the hand sanitizer on the mixing with other products and can create a new chemical which might cause harm to the user. The temperature screening on entrance to certain facility is a great initiative. However, management must ensure that staff is equipped with the knowledge and the know-how to use the thermometer properly. And what is considered normal temperature would be 37 degrees Celsius or 98.6 degrees Fahrenheit. You need to know that because you will be able to manage the temperature of the consumers or customers while they go in. Anything above 36.6 degrees Celsius or 99.8 degrees Fahrenheit is a call for alarm, and you can set the person aside for a few minutes, then repeat the temperature. And if you still get the same high temperature of 99.8 degrees Fahrenheit, then you should call the COVID hotline. The department has been working in collaboration with the Discover Dominica Authority in reviewing of COVID-19 action plans and conducting initial assessments of accommodations for certification. With the introduction of Safe in Nature, we now form a part of the monitoring committee who is tasked with ensuring the health and safety protocols developed by the Ministry of Health and the Ministry of Tourism are adhered to. To date, there are 61 COVID-certified accommodations, 23 managed experience accommodations, 2 tour operators, and 3 water sports certified in the Safe in Nature initiative. Failure to comply with the protocols can result in the revocation of the certificates. We are therefore appealing to management to adhere to the protocols and measures outlined in your action plans. Officers also work with the police department in the reviewing of applications for events and conducting assessments of venues prior to the events. Surveillance is also done during the events to ensure compliance of the protocol by the patrons and organizers. Failure to comply can result in the event being cancelled. Organizers, therefore, must guarantee that all health and safety measures outlined in the guidelines are implemented prior to applying for permission to have an event. Organizers must ensure the following. 1, that there is adequate space to facilitate social distancing of at least 36 square feet per person. 2, all facilities for hand hygiene, such as hand sanitizing dispensers, functional hand washing sink with soap and paper towels are available. 3, receptacles for waste are provided on site. 4, staff is available for the monitoring of patrons to ensure compliance. Our children are considered to be a valuable group. All measures established to safeguard their health and safety during school hours must be followed. Parents, you are to ensure that your children are equipped with their mask and hand sanitizers at all times. We strongly advise the teachers to continue sanitization of the highly touched surfaces. Churches and places of worship must also play an important part in the health and safety of users. As such, the leaders and congregants must ensure that members wear their masks, sanitize their hands, avoid hugging and handshaking, and maintain social distancing. In conclusion, the general public must at all times adhere to the health and safety protocols. Again, I emphasize the use of the wearing of masks at all times, social distancing even when there are no markers, frequent washing of hands, and if soap and water is not available. And for hand washing, use your hand sanitizer. Remember, 1 ounce of prevention is worth a pound of cure. Thank you.
Thank you so much to Calma Louis, Senior Environmental Health Officer, and of course the entire Environmental Health Department. Our final presenter this evening represents perhaps one of our staunchest supporters and collaborators and partners in this fight against COVID-19. We welcome the Acting Deputy Chief of Police, Davidson Valerie.
Minister of Health, Wellness, New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Director of Primary Health Care Services, Dr. Gilida Nesty-Tonge, National Epidemiologist, Acting, Dr. Shalauddin Ahmed, Senior Environmental Health Officer, Calma Louis, members of the media, members of the listening public, good evening. This evening's briefing will focus on large and other gatherings, wearing masks and hosting of events. The government of the Commonwealth of Dominica has enacted legislation to govern gatherings and wearing of masks. The regulation is known as the Environmental Health Services COVID-19 Amendment Regulations 2020. Throughout the length and breadth of Dominica, with the exception of religious institutions and schools, there shall be no gathering of 200 or more people. No one shall host any event or activity where 200 people or more are gathered. No one shall promote or assist in promoting any event or activity where 200 people or more are expected to gather. No one shall attend any event or activity where 200 people or more are gathered. A police officer has the authority to disperse any large gathering. Anyone who does not comply with the order of the police officer to disperse commits an offense. In order to host any event, in order to host any event targeting 50 people or more, written permission from the Chief of Police must first be obtained. The event organizer must meet a number of conditions stipulated in the event application form before permission can be granted. Some of the conditions that must be met are as follows. The organizer must be able to maintain a log with the names, addresses, and telephone numbers of everyone entering the event. The organizer must ensure that proper signages for wearing of masks and sanitization are properly displayed at the entrance and at prominent positions at the event. The organizer must also enforce the wearing of masks or other suitable covering during the event. The mask or other suitable covering must be worn above the nose and mouth. Additionally, everyone will be required to use a mask while 1. Using a motor omnibus, hiring car or taxi, or any public transportation. 2. in public buildings, including supermarkets, retail and wholesale commercial establishments. 3, at a bar, market, or other similar business or place. 4, other public spaces, including parks, riverbanks, and beaches. A police officer, a police officer or the owner of a premise that the person has entered or is seeking to enter may request anyone to remove or adjust his mask or suitable covering for identification purposes. Anyone found not wearing a mask in breach of the regulations commits an offense, and on summary conviction to a fine of $75. So far, we have received a total of 30 applications to host various events and activities. 5 of these 30 events were successfully held, and the remaining events were cancelled by the organizers. One of the events approved was the hosting of the Recovery Knockout Championship organized by the Dominica Football Association at the Windsor Park Stadium on Sunday, November 15, 2020. However, the last game had to be cancelled for various breaches of the COVID-19 protocol. So the last game was in fact called off during the play. A number of people were found not to be wearing masks. The number of people at the event was greater than what was permitted. Social distancing protocols were not observed. A few people were observed to be entering at unauthorized entry points. A case in point was the breaching of the perimeter fencing. Ladies and gentlemen, COVID-19 is not a joke and should not be taken as such. The Commonwealth of Dominica Police Force is once again appealing to everyone to observe the COVID-19 protocols. We pledge our commitment to continue to work with the Ministry of Health and other stakeholders to enforce the laws of the Commonwealth of Dominica. We can and we must do so together. Protect yourself, protect others, protect Dominica. Let us observe the protocols. Maintain safe distancing, wash your hands regularly, and please wear your mask. Thank you.
Thank you to the Acting Deputy Chief of Police, Davidson Valerie. Ladies and gentlemen, very quickly, a recap. We're now at 17 active cases here in Dominica. 4 of those new confirmed cases this week. Although there is no need for panic, there is an increased need for vigilance, and that is what we're encouraging. I want to say a special thank you to all our presenters, a special thank you to all those in the COVID-19 fight. For many, it is a thankless, tireless job, and the only reward to look forward to is the fact that you are doing your part to keep others safe. And the way that you, the general public, can do your part to help is to comply. Please adhere to the protocols that we've been encouraging for so long. It is to your benefit. Protect yourself, protect your loved ones. We thank you for your time and attention. We thank you to our media partners for making the broadcast possible. Have a good evening, ladies and gentlemen.